Hey everyone, welcome back to the channel. Today we're diving into a topic that impacts millions of Americans, the state-by-state health of our nation. In this video, we're counting down the 10 least healthy states in the US and exploring the issues each one faces, from high rates of chronic illnesses and obesity to mental health challenges and limited healthcare access. These rankings are based on recent data looking at factors like life expectancy, obesity, chronic diseases, and more. It's not just numbers, though. We're breaking down what makes each state unique, the struggles they face, and why some health issues hit harder in certain areas. Stick around to see if your state made the list, or if you're curious about the factors impacting America's health. Whether you're a resident or just interested in the state of health across the US, there's a lot to learn. Let's dive in. Number 10, Ohio. Ohio begins our list with a range of health issues, including high rates of chronic diseases, mental health challenges, and obesity. The obesity rate in Ohio is approximately 34.6%, which contributes to the prevalence of diabetes and heart disease. Frequent mental distress affects around 16% of residents, and the state ranks poorly in life expectancy, with an average of 75.1 years. The state's health outcomes reflect socioeconomic disparities, which impact access to healthcare and resources that could help reduce these chronic health issues. Number 9, South Carolina. South Carolina's health challenges are widespread, with significant issues related to obesity, chronic diseases, and mental health. The state's obesity rate stands at around 36.2%, and prediabetes affects approximately 34.9% of the population, both indicators of a higher risk for diabetes and cardiovascular diseases. Life expectancy in South Carolina is 74.8 years, the 10th lowest in the country, underscoring the long-term impact of these health risks. The high rates of chronic illnesses are exacerbated by limited access to preventive health care, particularly in underserved areas. Number 8, Oklahoma. Oklahoma ranks low in terms of general health, with a high prevalence of obesity, mental health issues, and chronic diseases. The state has an obesity rate of around 35.9% and one of the highest rates of prediabetes. Mental health distress affects around 17% of Oklahomans, contributing to the state's poor ranking in mental wellness. Life expectancy in Oklahoma is around 74.1 years, lower than the national average, and reflects the impact of these health issues and limited healthcare resources, particularly in rural areas. Number 7, Tennessee. Tennessee experiences a high rate of health-related issues due to lifestyle and socioeconomic factors. With an obesity rate of around 34.8%, the state ranks 13th in obesity, but is still above the national average. Tennessee's life expectancy is one of the lowest in the nation at 73.8 years, which is linked to high rates of chronic diseases, such as diabetes and heart disease. The pandemic also had a significant impact on Tennessee, with the state recording a high case rate, which exacerbated existing healthcare challenges and strained the healthcare infrastructure. Number 6, Louisiana. Louisiana's health struggles are influenced by high levels of poverty and limited access to healthcare services. About 30.8% of residents report no regular exercise, and the state has one of the highest rates of obesity, affecting around 36.2% of the population. This lack of physical activity, coupled with a high prevalence of chronic conditions, contributes to Louisiana's low life expectancy of 73.1 years. Mental health is also a concern, with approximately 17.6% of residents experiencing frequent mental distress, placing a strain on the state's healthcare system and reducing the quality of life for many individuals. Number 5, Alabama. Alabama faces significant health challenges due to high obesity rates and limited access to healthcare, particularly in rural communities. Nearly 39% of Alabama residents are classified as obese, ranking third highest in the nation, and the state also has a substantial prevalence of multiple chronic conditions, such as heart disease and diabetes. Infant mortality remains alarmingly high, with Alabama ranking second in the U.S. for this metric at 8.2 deaths per 1,000 live births. Mental health distress impacts around 15% of residents, and the state's overall life expectancy is low, averaging 73.2 years. Number 4, Arkansas. Arkansas ranks poorly across multiple health indicators, including obesity, mental health, and life expectancy. With an adult obesity rate of approximately 36.4%, the state sees a high prevalence of related health issues like diabetes, which is common among its residents. Mental health distress affects nearly 18% of Arkansans, one of the highest rates in the nation, contributing to challenges in overall well-being and quality of life. Furthermore, Arkansas residents face a relatively low life expectancy of about 73.8 years, reflecting both physical and mental health challenges that are exacerbated by a lack of healthcare resources in many rural areas. Number 3, Kentucky. Kentucky struggles with high rates of smoking and chronic health issues, which place it among the least healthy states in the U.S. The state has the second highest smoking rate, with about 23.4% of adults being smokers, which greatly affects public health and contributes to elevated rates of lung cancer and other smoking-related diseases. Obesity also remains a significant problem, with roughly 36% of Kentuckians classified as obese, which is above the national average. The state's rates of chronic conditions, such as diabetes and heart disease, are among the highest, and Kentucky's average life expectancy of 73.5 years reflects these health challenges. Number 2, Mississippi. Mississippi has the unfortunate distinction of having the lowest life expectancy in the nation, around 71.9 years, driven by factors like poverty, limited access to health care, and high obesity rates. Mississippi's adult obesity rate stands at approximately 39.7%, the highest in the country. This high obesity prevalence contributes to chronic conditions, such as diabetes and cardiovascular diseases, which are more common in the state than elsewhere. Additionally, Mississippi ranks poorly in infant mortality rates and has a high rate of food insecurity, affecting the population's overall nutrition and well-being. Frequent mental distress affects around 17% of residents, influenced by socioeconomic challenges that impact access to mental health resources. Number 1, West Virginia. West Virginia consistently ranks as one of the least healthy states due to a mix of physical, mental, and substance abuse-related health issues. The state holds the highest adult smoking rate, with approximately 25.2% of adults reporting tobacco use, contributing to increased risk for respiratory and cardiovascular diseases. West Virginia also has one of the highest drug overdose mortality rates, around 48.3 deaths per 100,000 people, making it the most affected by the opioid epidemic nationwide. Obesity is another major issue, with nearly 39.1% of the population classified as obese, leading to a heightened risk of heart disease, diabetes, and other chronic conditions. These health issues collectively result in one of the lowest life expectancies, averaging around 72.8 years, which is significantly below the national average. Well, there you have it, the 10 least healthy states in the U.S. As you can see, each of these states exhibits unique health challenges driven by a mix of lifestyle factors, economic constraints, and limited access to healthcare resources. Efforts to address these issues require a combination of policy changes, increased healthcare funding, and public health initiatives focused on prevention and wellness. We hope this video has been informative, and if you've watched this far, please take a few seconds to give the video a thumbs up and hit the subscribe button so you won't miss any of our future content. Thanks for watching, and always have fun.